It's terrifying and bewildering enough to suffer mental health problems as an adult, both for the individual concerned and for their immediate family. Imagine that happening with a child or young person. The worry and concern is just magnified many fold. And then imagine on top of that, when you're desperate to be accessing help from professionals, you cannot access that service. Whereas if your child slips over in a playground and breaks a leg, they will go to hospital and that will be mended. And that provision is there. If your child's got the flu, they can go to the doctor. Physical ailments, the provision is there, and because they're more obvious and dealt with. And that really makes it all the more scandalous that specialist provision isn't readily accessible to the children of Kent. And these latest statistics are really just so depressing, that a government target is being missed on such a scale, against a backdrop of such historic problems which were meant to be being put right, and clearly, evidently, that's not happening.
Well, let's talk about those statistics, because it was only just before this interview that I told you your initial reaction was a very sharp intake of breath and to shake your head. I mean, you seem quite concerned.
Well, yes, of course, because, 6 weeks is a long enough time for people facing these difficulties. Of course, everything is resource dependent, but that's not an overly ambitious period of time to be seen if you've got mental health problems as a child or young person. The fact that modest ambition we are falling far short of.
Well, less than half.
And what becomes of the statistics behind that? How long are people waiting? When I've looked at this before, the worst waiting periods are horrendous.
When we talk about figures and missed targets, it all sounds very clinical, and it's all just about numbers and very distant, but you can forget that there's a very strong and deep human cost.
Yes, absolutely. And the despair that families experience, as I say, it can be a very frightening and bewildering time when a loved one suddenly presents with mental health problems. But if you add to that it's your child, and if you add to that the anguish of not being able to access services, so you're just literally left there coping yourself with something you're not qualified to cope with, you don't even start to understand. People are in such need of that specialist input. So it's really unsatisfactory, and it's obviously affecting a huge number of people. And they're often people who are very vulnerable, and they're not able to access other alternatives. They're wholly dependent on being able to receive the service that's meant to be there. The other problem is as well, it's quite, if you have a target, and as I say, it's not an ambitious target, if you have a target and people are told 6 weeks and they're hanging on to that 6 weeks and coping up to that 6 weeks, and then that target is just ignored and slips by, you don't know where you are. If you've got targets, whether it's for cancer referral or whatever it might be, you need to stick with them. And yet here we are, not even performing at half tilt, as it were. So it's a wholly unsatisfactory.